How much did it cost? How was recovery? How did you tell your parents? What's the pain scale from 1 through 10? Hi guys, welcome back to my channel. Today I'm going to be doing a nose job question and answer. So I did a nose job journey where I took you along my recovery period and like my surgery. I'll have that link down below if you're interested. In this video I'm just going to be answering like commonly asked questions. Before I got my nose job, I did a lot of research and I watched a lot of YouTube videos just like this. So I thought me making this video would be helpful. So I'm currently at 6 months post-op. I got my surgery in February, so the swelling has gone down significantly. And I explained in my other video, but I got a revision rhinoplasty, so this is not my first but second time getting a nose job. So I feel like I went through the experience twice, so I can truthfully answer these questions and like give as much input as I possibly can if you're considering getting a nose job or like nervous. So yeah. So there's two types of nose jobs you can get. You can get an open rhinoplasty or a closed rhinoplasty. So for an open rhinoplasty, they basically open up your nose, so then you would have an incision in between your nose. I have one, but it's not very visible anymore, like it fades away. A closed rhinoplasty is less invasive, so they cut the inside to access like the inside of your nose. So its benefits are that you have less swelling, less scarring. Your recovery time is usually shorter because you had less trauma to your face. So the reason why I got an open rhinoplasty is because my doctor said he would be able to get a better view of my nose that way. I got a nose job because my nose was broken. He said he would have better visibility if it was an open rhinoplasty, so that's why we went that way. The only, I guess, negative of it is that the recovery time is longer, and I got cut open like right here. I don't think you can see it, but I basically have like a really faint red line where the incision was made, but over time it will like disappear basically. But you can't really see it unless someone's like standing directly under me and like staring, you know? Okay, so do I regret getting a nose job? Absolutely not. I kind of always wanted a nose job since I was like in middle school. I wasn't like happy with my nose, but the reason I got the nose job in the first place, I feel like I didn't have an option. My nose was broken and I had to get surgery. So I basically just told my surgeon to like tweak a couple things and just give me the desired look that I wanted. But I don't regret it. It definitely brought me a lot more confidence. I like my profile a lot better now. Like it's like cute. I had like a little swoosh. I think it's your face. You're gonna have it with you for the rest of your life. If not to sound dramatic, but I mean, if you want to make a tweak to your body, why not? You know, I can use makeup and contour my nose and get a desired look. Why is it wrong for me to go under the knife? At the end of the day, it's your life, so do whatever you want. But yeah, I do not regret it at all. Okay, so the next question I get asked a lot is how did I find my surgeon and who was my surgeon? So my surgeon was Dr. Undavia. How did I find him? So basically I just looked up surgeons within my area, and then I went on his website and he had a lot of before and afters and like reviews of patients. And I also looked on his Instagram and like went through like his comments and like stalked his like patients basically. So when I was looking for a surgeon, I wanted to make sure that he had experience on someone like me. So someone that's a person of color, someone who had thicker skin, someone who had a flatter bone, and yeah. So after my first consultation, I felt pretty comfortable with him. He even like created like a 3D image of my face and contoured my nose, like shaped it within his software, so that I could have a visual of what my nose would look like after the surgery, which I liked a lot because he was very like transparent with me. And I did do a lot of research on him, like I stalked him. You have to love your surgeon in order to love your results. So you have to be extremely picky and make sure they understand exactly what you want. Even like the morning of my surgery, I literally recited everything that I wanted to my doctor just to make sure like before I went under the table and before I was knocked out, he knew exactly what I wanted to get done. So what's the pain scale from 1 through 10? So I kind of went over that in my other video, but to sum it up, basically, after the surgery, you wake up, you don't feel anything, you just feel like drowsy. Like I felt really sleepy, but I didn't feel any pain, but also I was like on strong pain pills. Basically, you kind of feel like uncomfort, like if you have a brick on your nose or someone squeezing your nose. Like imagine a headache, but on your nose or like the central part of your nose. Okay, so because I had an open rhinoplasty, remember how I said I had an incision in the bottom? So I had stitches there, and that's like the skin that's connecting my lips. So when I would talk or when I would eat or when I would brush my teeth, I felt like every time I opened my mouth, it would pull on the stitch, so it would hurt and it was painful. But other than that, I wouldn't say it hurt. I would say maybe the pain scale is like a 4. But also you're on a lot of pills, so you're sleeping a lot because it makes you drowsy. But after like the 4th day, I stopped taking my pain pills and I was perfectly fine, and I don't have a high pain tolerance. So it's not really painful, it's just uncomfortable. Another thing that's uncomfortable is that your body's basically trying to heal itself, so it's producing a lot of mucus in your nose. So you have a lot of mucus that's coming out and blood in the beginning, so you can't breathe from your nose. So outside from it just being uncomfortable because it feels like pressure on your face, you also can't breathe. So in terms of sleeping, I slept like this, basically like elevated. My back was like this. So because you have a lot of mucus and like blood in your nose, you don't want to be laying down and that to go back up your nose. So you have to sleep sitting up so that it catches it on like that little gauge that they put under your nose. Another reason for sleeping up is that it kind of minimizes you turning. If you're sleeping down, you could easily turn to the sides. When you're sleeping up, you kind of just stay in that position. But let's say you're sleeping down and you turn to the side, now you're putting pressure on your nose, which you shouldn't do. So I basically slept like that for like the first 2 weeks. Okay, so the next question is, how is the anesthesia? So I'm guessing this question was asked because people are scared to go under anesthesia. So basically before the surgery, they put a needle in me which like transfers fluids, and that's how they like transfer me the anesthesia. So I'm slowly like dozing off. I was pretty nervous, and my anesthesiologist was like trying to calm me down, like saying, where do you want to travel? What do you want to do when you grow up? Stuff like that. And I was like, ma'am, you're trying to put me to sleep right now. I know you're distracting me. But basically you doze off. Everything starts like becoming blurry, and then the next thing you know, you're knocked out. I wouldn't think too much of it because it happens so fast that you don't even notice it. Do you know like those scenes in like movies where someone's getting rolled in and they have like blurriness like that? Okay, so how much did it cost? So this is a very broad question, but I can speak on it like in my experience. So because my nose was broken, my insurance covered most of it, and then I paid for the extra stuff because I had cosmetic stuff done to me. So let's assume my insurance didn't cover part of it. My total nose job would have been about $6,000 because you have to pay the surgeon, and then I had to pay the hospital and the anesthesiologist. So when you add it all up, that's around the average that it comes out to. So I think that honestly wasn't that bad. I mean, I looked at other surgeons and some people were charging 12K, 15K. Some surgeons were charging 4K. So I think it just depends. I also know you can go out of the country. Like I know Turkey is very popular for nose jobs, and that's a lot cheaper. And I have seen a lot of like amazing results from it. I wanted to get it done in the US only because I wanted to have the option to like go to my doctor in case anything were to happen, or I was just very paranoid. So I wanted to be able to be seen by my doctor in case anything happened. I didn't want to have to think about like, oh, I have to fly out. Nothing bad happened, but that was just like my thoughts at the time. So how long did it take for me to breathe normally? I would say it took about 2 to 3 months because you're constantly getting mucus. So I'll insert a picture of what I used, but I had to basically do nasal rinses, which was basically like squeezing a tube that had like saline water in it, and the water would go up one nostril and come out the other. Because of that, I wasn't really breathing normally. So I would say about 2 to 3 months before I actually started breathing normally. For the most part, your nose is always clogged, but gotta pay the price to have a cute nose. So the next question is, how was the recovery? I feel like you're never ready for the recovery of it. Even after my first nose job, when it came to my second one, I was pretty shocked by the recovery of it. So in the beginning, the first like 2-3 days, you're sleeping, you're on pills, and it just feels like pressure. And during the surgery, they put a tube down your throat so that you can like breathe. And because of that, your throat feels very like dry. You feel like you're like dehydrated. Then I got home, knocked out right away. Had a lot of boogers, had a lot of blood. Cleaned that out. In terms of sleeping, like I said, you have a lot of mucus, so you can't really breathe. You have to breathe through your mouth, which means that your mouth gets very dry. And specifically for me, I don't really breathe through my mouth when I'm sleeping. I breathe through my nose. So at night, I felt like I was suffocating. Like I remember I kept waking up in the middle of the night like, oh my god, I can't breathe. Which is pretty scary. And I remember that I wanted to cry, but because you have a cast on your nose, you can't wet it. So I couldn't cry, and then I was just sad that I couldn't cry, and then I was mad that I couldn't breathe. So yeah. So then now you're 1 week after the surgery, and at that point your surgeon would take your cast off, and if you have like splints up your nose that some surgeons use, they would take that off at that point. My surgeon also used a vacuum to clean out the mucus in my nose, which was amazing. At this point, your nose is extremely swollen. Like I remember I looked at myself and I looked like an avatar because your nose is swollen and you kind of feel like, damn, I regret this. You also have to realize when you get a nose job, it can take a year and a half for the swelling to go completely down and to settle down to what your nose is supposed to look like. So you just have to wait it out. You're gonna look swollen, your nose is gonna look big, but yeah. So I mentioned earlier that it's really hard to open your mouth because you have stitches under your nose. Because of this, I was eating a lot of liquids or like mashed potatoes or something that just didn't require me to open my mouth a lot or too hard. I would say for like the first 2 weeks, I was basically like losing weight because I was drinking a bunch of liquids and I didn't really have an appetite because I couldn't eat what I would normally eat. You're also like very swollen, so you have a lot of water retention. So even me smiling, my face felt really stiff and I couldn't really do it. I also had like yellowing under my eyes. I know it gets bad for a lot of people when they get like black and blues. Mine was just like yellow. It wasn't really too much bruising, but I did get a lot of swelling. So this is how I would talk when I had the surgery. I would talk like this because I didn't want to move my mouth a lot and it would hurt to move my mouth. So I was like stiff. I would say that my bruising after the first week, it went away. After they take the cast off, it's a little bit hard mentally because you had an image of what you wanted your nose to look like and what you looked like before the nose job, and now you're kind of like in between where you feel like you look ugly. But to be honest, just wait it out. After I would say like 2 months, I started looking normal again, where I felt happy with how I looked like. I still definitely had swelling, but at least it wasn't that bad. I would say after like the second month, I started to look like myself again, but in the meantime, you kind of start to regret it and kind of like, dang, I shouldn't have done the surgery, but we'll get better. Another thing too, you're also not allowed to work out or do like any like sports, which is like pretty obvious, but I believe I wasn't cleared to like work out or like lift after 4 months out of surgery. Think about it, it's a nose job. They like most of the time they either break or shave down your nose, so you shouldn't be doing anything that's like can cause trauma or that can alter what your nose would look like. So just sit down and don't do anything. Okay, so how did I tell my parents? So I would say my parents were very like non-supportive and they didn't really want me to get the nose job, but they gave me that nose. Like they tried to like, I guess, lecture me. I didn't get a nose job because I hated how I looked. I kind of already had my mind made out to it. At the end of the day, that nose is not going on my mom's face, that nose is not going on my dad's face, like it's going on my face. So I need to be the one that likes it, and if I'm the one that wants to get it done, then I'm gonna get it done. Basically just explained that to my parents, and at the end of the day, like, I paid for it. There's nothing they could really do about it except for like try to talk me out of it. I think my mom was very pleased that I did a lot of research and she came to like my appointments with me, so she knew that I was in good hands, and she knew that I knew that I was in good hands and that I had all my questions answered and she had all her questions answered. So that brought a lot of clarity. So I think it's very important to do your research, because anytime my mom had a question for me, I knew exactly what to answer. So she couldn't catch me slipping or be like, you shouldn't even get it, you don't know what you're talking about. I knew what I was talking about because I did my research. I hope I was able to answer a lot of your questions. And if you have any questions, you could leave them down below. I'll literally answer to everything. Or I have my Instagram down below. You can also DM me. I've answered a couple questions through there too, if you want like more of like a personal approach than like a public comment. Also, another thing I wanted to mention, if you're stuck between getting a nose job and you're like really on the verge of it, maybe try experiencing with fillers. That way you can alter your nose, but you kind of get like a preview of what a job will look like. But yeah, thank you for watching. Remember to like and subscribe if you want to. And yes, bye.